It was a difficult walk to work for the Health Secretary, Andrew Lansley.
We're having a constructive discussion with clinical leaders.
Why are some groups invited, not others?
What's the point of going in today when we're talking a balanced group of people who are interested in clinical leadership and a constructive discussion about how to achieve clinically led commissions.
He might have dispatched the journalists, but he didn't reckon on 75-year-old June Hortot.
You can wait. Let you wait for change. You can wait. You can wait like people are waiting for a bed now. And when it goes private,
it will not go private.
Oh, God, what have you been privatised since 1979? Don't you dare lie to me.
79?
You're not going with. I'm not letting you go. No, I'm not letting you go. No, I've been waiting at this game for 10 years.
The Health Secretary had a second entrance to head for, but many didn't even have an invite to the NHS roundtable. Those most fiercely opposed to the reforms, including the British Medical Association and the Royal College of GPs, were among those left standing at the gate.
Don't shake your head! He's gutless, he's a coward, and he's got no conscience. They only look at the few who didn't vote against it, not the majority who vote against it, always the few. They only look at the few because they know the majority are against them. So they never invite the majority, only their little few.
From the anger outside to the calm of Number 10. The Prime Minister sitting next to Andrew Lansley in a public show of support.
I'm committed to the changes, committed to taking them through, but we need to do everything we can to explain to people this is about improving and enhancing our NHS, not in any way endangering it.
Hello.
The Prime Minister may sound confident, but many think this is his biggest weakness. On the other side of London, Ed Miliband was keen to reinforce the point, visiting a children's ward in Hackney. But there are still some who want to engage with the government.
The NHS faces enormous challenges, and we need every single member of staff to be aligned and ready to perform better than they've ever done before. So it's absolutely critical that whatever happens from here on in, that all the clinical community feel that they're able to commit to the National Health Service.
Andrew Lansley did eventually get through the doors of Number 10, and he may even have won over some of those inside. But he's still got to get his controversial bill through Parliament and convince the people out here on the streets that his reforms are right.
Whose NHS? Our NHS!
With more than 1,000 amendments, Westminster insiders call this the bill with no friends. But for all the clamour and the noise, the government is determined to push it through. Sophie Ridge, Sky News, Westminster.